And now, it's Boomer Life. Lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Doctor, give me the news. I got a bad case of loving you.
Welcome to Boomer Life on CIL 650. Today we're going to talk about what is becoming a national epidemic, or at least we now realize it's a national epidemic, and that's obesity, and some of the important work that is being done to help people get past that. Joining us today in studio, Dr. Chris Coburn, the medical director and surgeon at the Smart Shape Weight Loss Center, offering the most comprehensive weight loss management programs like lap band, gastric sleeve, and gastric balloon. Programs aimed at achieving sustained weight loss. Welcome to the show, Dr. Coburn.
Thank you, George. It's good to be here.
Do you think it is a surprise to people even today to find out that obesity is a disease?
Oh, absolutely. And we talk about obesity as a disease, and it's important to remember that it's not the weight that's necessarily the issue. It's all of the myriad of health problems that go along with being overweight for some people. These can include diseases such as diabetes, high blood pressure, elevated cholesterol, sleep apnea, joint problems, arthritis, but a whole series of cancers are even related to being overweight as well. So we need to keep the big picture in mind when we talk about the problem of obesity.
And when you talk about big picture, the one element in that is it's tough to admit that you're obese. I think in a lot of cases, and who's going to tell you that you are obese?
Right. So it is. There's an element of, I wouldn't call it shame, but an element of denial for sure. In fact, there are a lot of people who are overweight and don't see it as a problem, and that's fine. When we talk to our patients at SmartShape, we want to find out why is their weight a problem for them as an individual? Does it have to do with their health? Is it the way they look, the way they move, the way they feel? Let's identify what the problems are with your weight, and let's work towards some very effective and viable solutions for those.
Well, we talk about the disease. Let's talk about the statistics in Canada. What kind of numbers are we talking about?
So we measure weight by something called body mass index, or BMI. You can calculate your BMI very easy by going onto one of the many websites that makes it available, but it's a function of both your height and your weight. And when you calculate your BMI, if your BMI is between 25 and 30, you would be classified as overweight. Under 25, we consider normal. Above 30, you start to get into the obese population, and then morbidly obese and super obese and a whole bunch of different categories. But if you talk about the magnitude of the population, currently about 60% of Canadians are either overweight or obese. When we talk about potential surgical solutions, we're generally talking about people with a BMI above 35, and that applies to 10% of the Canadian population. So about 3.2 million people would be candidates for a weight loss procedure.
So if I hear you right, almost 2/3 of Canadians have some kind of obesity problems, people who are overweight at the bottom end of the scale, if you will, and then as you get into people with that higher body mass index, that's where we start talking about obesity.
Yes.
And those might sound like clinical numbers for the person who's sitting there wondering. They may know it. They may not be ready to admit it to themselves. So how do they sort of square up to this thing? I mean, you don't do a BMI test on yourself, do you?
No, but and again, we're not so much concerned even about their BMI, but we are interested in talking with and working with people who perceive their weight to be a problem. What is the problem, and what can we do to fix that in a safe and sustainable manner? And everybody has their own comfort level as where they want to be, how they want to live their life. Because the big problem with being overweight or obese, again, is all of these metabolic and health problems that go along with it that affect not just how long you live, but more importantly, the quality of your life as time goes on.
That, to me, you can say, well, okay, so I'm obese, and maybe I'm not going to live as long, but so what? Yeah. But the thing is, people may not be realizing before these problems start to show is that those last years of their life could be very, very poor,
Yeah.
perhaps even wheelchair bound,
Yeah.
unable to be part of society.
All sorts of different issues. We at SmartShape, uh, we certainly know that about 80% of the patients that we provide procedures for or programs for are women. And weight has a different persona or a different perception for women than it does for men. Men, interestingly, tend to suffer the comorbidities, the health issues associated with weight, more severely at the same level of weight or BMI than women do. But men don't perceive their weight socially to be the same problem that it is for women. Men tend to carry their weight more centrally inside around the organs, and that fat, if you want, is more dangerous to you. Women tend to carry their weight more peripherally on the hips and the buttocks and abdominal wall, where it's less dangerous, but sometimes more obvious.
We could look at this, and I don't want to use the word as aesthetically, but well, or you're just talking about people who are, they just want to take a couple of pounds off so they can buy stuff off the rack. But the reality is that I would think that if you start with this problem and it keeps getting worse, and you deny it or you don't deal with it, you can't. It goes beyond anything that's aesthetic. That's when you start running into the bigger health problems.
Sure, and exactly. And what's interesting about the traditional treatment methods for being overweight, dieting and exercise, is that unfortunately they're not terribly effective. People may be able to lose weight with diets, but to be honest, losing weight is not the challenge. It's keeping it off. And unless you keep weight off, you're not able to enjoy the health and the social benefits of that. And in fact, dieting has been shown in a number of studies to generally lead to weight gain over the years rather than sustained weight loss. So we certainly recommend all our patients do what they need to do to be convinced that the more traditional, if you want, methods of diet and exercise do not work for them before they consider some of our weight loss surgical programs.
And one of the reasons we're having this conversation today is that in many cases people have to take that first step by themselves, and they're afraid.
Yeah. Yeah, and so at SmartShape, we have a very comprehensive website where people can get information about the disease of obesity, get information about the gastric balloon, the gastric band, and the gastric sleeve programs that we offer. And we wanted people to just give us a call. Just talk to us, look at the website, speak to our highly trained professional team, and we can talk to you about what the options might be if weight is a problem for you.
And this is something that you need to have the conversation with people about before they can make that commitment to move on.
Yeah, so it's a lot of what we do is just talking to people. We again talk to them about options. If they choose to speak to one of our surgeons, they do that at no cost. But we really just want to inform people about what the options are.
Okay. The website again?
www.smartshape.ca. Available, comprehensive, and through that you can get in contact with us, no problem.
Perfect. I want to talk a little bit more about the health issues that are caused by obesity in more specifics. I would think that diabetes has got to be the number one. They talk about it being the epidemic. Well, I would imagine then that one of the great causes or cause and effect is the person who's obese.
Absolutely. So type 2 diabetes has been described as a tsunami. There's a tsunami of type 2 diabetes in Canada now. This is a description from the Canadian Diabetes Association. And we know that about 90% of individuals who are type 2 diabetic are overweight or obese. The fact we use the term diabesity to describe the linkage between diabetes and obesity. So as people gain more weight and their BMI rises, their risk of developing type 2 diabetes rises exponentially. And we know that. But what seems to be less well appreciated, especially among some of the medical practitioners, is that if you can achieve sustained weight loss and bring your weight and your BMI back down towards a normal range, then in fact diabetes can be put into remission. We don't talk about cure because if the weight came back, the diabetes would come back. But remission means not needing medications anymore. People are think, or even some medical practitioners have the feeling that if you have diabetes or you have high blood pressure or sleep apnea, as long as you take a pill or you have a CPAP machine, that you no longer have that disease anymore. And that's just not true. Diabetes continues despite treatment. The underlying health issues, the heart disease, the cardiovascular disease, the renal disease continues despite the fact that your diabetes is being treated. What we need to do is achieve significant and sustained weight loss with programs such as we have at SmartShape that allow you to keep the weight off and make that disease go away.
And in cancer, in the case of cancer, they're starting to link a lot of the problems from obesity can lead to some forms of cancer.
Oh, absolutely. Breast cancer, prostate cancer, colon cancer, esophageal cancer. There's many different cancers that are actually linked to being overweight as well. There are other factors in there as well, but certainly from a health issue, the issue of diabetes is probably the most significant health issue. You know, obesity is now the leading cause of preventable death in North America. It surpassed smoking about 5 to 10 years ago.
Let me get that right. That smoking, which we spent millions of dollars in training and advertising and research and getting people to believe, okay, that there is not just a link but a cause and effect. Now that's been overtaken by obesity.
Yes, obesity, and again those health issues related to it. And it's unfortunate that there's too much blame in obesity. Somehow we seem to blame somebody if they're obese. We don't blame them if they're diabetic, and we don't blame them if they got high blood pressure, but we seem to think that obesity is their fault, and it's not. Obesity is a disease that people can't control any better than we can control your blood pressure without treatment. So we need to bring this disease into the forefront, and we need to find effective ways and funding to treat it.
How are you finding the rest of the medical community, like doctors, general practitioners? Are they starting to embrace what you can offer to help their patients?
Absolutely. I mean, we are finding the recognition of, again, the significance of this disease. Certainly doctors are becoming more aware of it. Everybody knows about it. But what we need to do is give them effective treatment options, because advising patients to diet and exercise is rarely, if ever, effective at sustaining significant weight loss. So we need to educate the public. We need to educate the medical profession about what's available. What does SmartShape have to offer? Surgical procedures that can be done safely and effectively.
I think before we started the show today, and you were talking about something, is that some people call obesity or dieting to stop obesity is like the guaranteed way to put on weight.
Yeah, I mean, as I said, dieting has been shown to actually lead to weight gain over time. And many of the weight loss programs, the established weight loss programs that are out there, good programs, have now recognized that what their goal is to stop the weight gain, the inexorable weight gain that continues with time with a lot of these patients. That's fine, and those are admirable goals, and I think we need to do that. But if you want to achieve that kind of health benefits from sustained weight loss, then the various surgical options that are available need to be considered. And that's what we want to do, is provide people with options.
Let's talk about some of those procedures in our next segment. We're talking to Dr. Chris Coburn, the medical director and surgeon at the SmartShape Weight Loss Center. This is all part of Boomer Life on CIAL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIAL 650.